Good day, I'm Langkai Lim, and my metric number is 271467. Today I want to talk about the history of occupational safety and health. At first, we must understand about the difference between safety and health. Safety usually will affect immediately, for example the injuries and accident, while the health normally need to take a long time to show the negative effects, for example the disease and illness. In the history of the occupational safety and health, there are a few contributions. First is the contributions of major civilizations. The history of occupational safety and health starts with the era of King Hammurabi, who is the sixth king of Babylon, but is the first king of Babylonia Empire. He promoted the code of law, which is about an eye for an eye, a tooth for a tooth. It refers to the idea that people should be punished according to the way that offended. Because of this code of law, there are not much warding and homicide cases in the area of Babylon. Besides, he allows the fees for physicians and monetary damages. So he introduced a new rule, which is doctor can charge the patients. So as a result, the field of medicine flourished in Babylon because people with the medical knowledge can earn an income, and also the health of the people in Babylon has improved. The third contribution of Hammurabi is compensation for injuries. So the next civilization is ancient Egyptian, Ramesses II. He promoted a regular medical examination, sick workers were insulated, and also the industrial hygiene, which take care the personal hygiene of workers that take a bath once a day. The third civilization is Roman Empire. So in Roma, the provision of the public health facilities throughout the empire is encouraged. In addition, a good drainage system established to prevent the bacterial disease and build public bathrooms or toilet for who do not have such facilities in their homes. The last civilization is the Islamic Empire. Developments of knowledge and practice in the medical field. Before, the hospital only for the royal family or the king, but after that, Arazi start to build hospital for public to have treatment service. The level of the health is improved. Besides, the Arazi say that the movement can replace many medications, but not medications can replace exercise. So it means that the exercise can make body more healthy and encourage everyone to exercise. Next is about the contribution of major disease. First is the anthracosis, which is a lung disease that caused by the inhalation of smoke or coal dust. It usually in small amount over many years. Anthracosis, also known as black spit, the main patient of this disease is those who mining coal. The second is silicosis, which is a long-term lung disease caused by the inhaling large amount of crystalline silica dust, so usually over many years. This disease still an issue right now, especially in the cleaning industry. For example, the person that usually use the sandblaster to clean the dirty surface. The third is the mercury positioning, which is a toxicity from take too much melted mercury or organic mercury. For example, the comestic that illegal. The mercury also can come from the seafood. For example, the waste from the factory dumped into the sea and cause the water pollution, then affect to the surrounding aquatic animals and plants. So when the person that eat too much seafood that surround that nearby the factory, so it can cause mercury positioning. And the last is the asbestosis, which is a serious lung condition caused by a long-term exposure to asbestos, the fiber like the material that was once to use in the building for insulation, flooring, and roofing. So there are four major accidents that in the occupational safety and health history. First is the hawk nest strategy. At 1930 until 1935, the result of the construction of hawk nest tunnel caused the large-scale occupational silicosis incident. The workers labor in the confined spaces with poor ventilation, lack of dust control, and limited use of personal breathing protection, and in result, silicosis claimed the lives of at least 764 workers. The second is Boba tragedy, or we can call it Boba disaster, that occurred in India because of the chemical gas leak and immediately killing at least 3,018 people and causing significant morbidity and premature death of many thousand people. This disaster occurred in 1984. The third is the Chernobyl disaster, which is in 1986. It is a nuclear accident, so it occurred when a reactor of the nuclear power station was destroyed by an explosion. So the people of the surrounding of this factory contracted serious radiation sickness, especially the workers at the factory. Because of this disaster has sparked criticism of unsafe procedures and design flaws and failed residents to the building more of this type of plants, which is the nuclear plants. And the last one is the bright sparkles fire that occurred in Selangor, Malaysia on May 1991. The accident caused by the explosive chemicals from experiments split and started fire. A total of 118 people injured and had property destroyed received a lump sum of 13,000 from the director of Bright Sparkles. Next is about the contribution of the scholar in the history of occupational safety and health. So the first is Aurelius, second is Agricola, and the third is Ramazzini. Next is about the contribution of unions. So there are a few rules of organized labor, or we can say that the contributions of unions. First is the fellow servant rule. It explains about the employers who not labor workplace injuries that result from negligence of other employees. Second is the contributory negligence, which explain about the action of the employees contribute to their own injuries. The employer was absolved of any liability. And the third is the assumption of risk, which explain about the employees who work voluntarily should accept the consequence of their action on the job rather than blame the employer. And the last is about the 3E in the history of the occupational safety and health. So the first is the engineering, which is about the design of the factory, equipment, tools, or the workplace, that everything should be designed by taking into consideration safety of people. It means that the design of everything must care about the safety of the workers or also the users. The next is about the education, which is training the employees to let them know about the safe work procedures, rules and regulation. Then the employees can behave accordingly and protect themselves from the unsafe act. And the third is the enforcement, which is about the laws, the punishment that given. So when the enforcement does not recognize difference in people, everyone will have the same penalty there. Everyone will have same penalty. Therefore, everyone will afraid to the rules and follow the act. So in conclude, the effective and efficiency safety and health management should include the engineering, education, and enforcement to reduce the accident or the injured that occur at the workplaces. Thank you.